Picture a dark, quiet house at 3 in the morning, except it isn't quiet. Every single night, an 84-year-old man sits in his room, clapping his hands together until the sun comes up. He can't sleep, which means his wife can't sleep either. This was the reality of advanced Lewy Body Dementia, a condition marked by vivid hallucinations, a stiff, shuffling Parkinsonian gait, and terrifying moments where his consciousness would simply vanish. These symptoms feed into each other, creating a relentless physical loop that overrides the body's internal clock. The hallucinations trigger anxiety, the movement issues prevent settling down, and the broken sleep cycle guarantees the exhaustion continues the next day. When a disease demands 24-hour vigilance, it spreads beyond the patient's brain. It becomes an environmental crisis that drains the shared reality, safety, and basic human need for rest from the entire household. Naturally, families in this situation look to medicine for a lifeline. But the options for advanced Lewy body dementia are notoriously narrow. This flowchart illustrates the pharmacological trap inherent to the disease. If a doctor prescribes a standard medication to calm the physical tremors, that very same drug often triggers a massive escalation in the patient's hallucinations. Treat the body, and you risk destabilizing the mind. Faced with these severe risks, his family began searching for any form of management that bypassed the digestive system and the needle entirely. They needed an approach that wouldn't add another volatile chemical to an already fragile system. The true roadblock to getting this household to sleep was the invasive, high-wire act required by standard medical interventions. The family eventually found an alternative approach. It's a small, flat herbal pouch that sits entirely on the outside of the body, resting directly over the navel. Looking at this biological schematic, the mechanical advantage becomes clear. An oral pill diffuses completely through the digestive tract and into the global bloodstream, whereas the navel patch relies on a localized barrier application. The defining principle of this therapy is its physical restraint. Absolutely nothing is swallowed, and nothing is injected. This isn't presented as a medical cure for dementia. Instead, it serves as a risk mitigation strategy, a low-stakes physical barrier method chosen primarily to do no harm while attempting to offer relief. The logic behind placing a patch on the stomach to treat a neurological condition stems from traditional Chinese medicine. In this diagnostic framework, Lewy body dementia is viewed as a failure of the entire systemic pattern, rather than a problem isolated exclusively within the brain. This network map visualizes the specific physiological failures at play. You can see blockages forming along the energetic pathways connecting the body's foundational roots, the kidney and liver areas, to the upper branches of the brain. The kidney-brain axis weakens, while severe stagnation takes hold in the liver channel. Because of these blockages, transition signals stall out completely. The body loses its mechanical ability to shift gears from one physiological state to another, trapping the patient in an exhausted twilight between wakefulness and sleep. The visible symptoms, the hallucinations and the shuffling, are the chaotic upper branches. The navel pouch aims to target the source by clearing those blockages at the root level, sending a steady, calming rhythm back up through the system. The underlying philosophy is straightforward. If you can stabilize the body's internal roots from the outside, you create an environment where the erratic neurological branches can finally settle down. For this family, the effects of that stabilization became undeniable by week 3. The frantic, all-night clapping stopped, and the patient began sleeping soundly from 7 in the evening straight through to the morning. As the sleep cycle repaired itself, the terrifying daytime distortions faded. The frequency and intensity of his visual hallucinations dropped significantly, replaced by a much calmer perception of his surroundings. His physical autonomy also started to return. On some days, his gait smoothed out enough that he could walk independently, leaving his walker behind. In this case, restoring the patient's ability to sleep coincided with a marked reduction in his daytime LBD symptoms. The most profound shift, however, was cognitive. For the first time in years, when his family asked him how he felt, he had the mental clarity to actually answer them. It is vital to note that these are documented caregiver observations from a single individual's experience. This is not the result of a massive clinical trial. and it does not come with a medical guarantee. But for a family that had spent countless nights paralyzed by exhaustion and fear, the 30-day trial provided something they hadn't found elsewhere: a period of sustained, predictable rest. When you are navigating the hardest nights of Lewy body dementia, having a non-invasive external line of support is a vital option to have on the table. Sometimes the best way forward is to use outside to support inside.